Hello, my dear students. I'm Dr. Vaishali Bharambe. I've been teaching anatomy for a long time now, almost 25 years, and I love it. Today, I'm going to teach you a very relevant topic, femoral sheath and then femoral hernia. Okay. So, as usual, please keep a packet of color pencils and drawing sheets ready because we are going to draw. Please draw with me. Let's begin. I want to start this lecture today with a case. Okay, a woman came to the OPD with a swelling in the left inguinal region. Think of your left inguinal region, okay? And she said that the swelling was associated with some pain. It increased on standing and reduced on lying down. Remember, every line is important, okay? There are hints about the case here. On examination, the swelling was found to be lying inferolateral to the pubic tubercle. Questions your examiner will ask you: what is this condition called? What is femoral sheath? What is femoral ring? What are the predisposing causes to femoral hernia? How will you differentiate it from other hernia? Let's find out the answers to all these questions, students. Come on. Right. So, femoral sheath and femoral hernia. How are we going to study it? First, I'm going to teach you femoral sheath. Then I'll take you to femoral canal through which the hernia takes place. And then I'll take you to the femoral hernia itself. Clear to you? Pehle sheath, then canal, then hernia. Sure? Let's begin. So what is femoral sheath? I've always told all of you, and you've been seeing my lectures now, always bring yourself into the class. Introduce the topic to yourself. What is femoral sheath? It's a fascial sheath which is somewhat conical. Encloses the proximal end of femoral artery and vein below the inguinal ligament. Fine by you? Do it again. It's a femoral sheath, or it's a sheath of fascia, funnel shaped, along the proximal end of artery and vein. Which artery? Femoral artery and vein, below the inguinal ligament. This definition is fine. I don't care for fancy definitions. It makes no difference. You should know the meaning more than know the words. Fine? Okay. So how did this femoral sheath develop? Now this is a longitudinal section through the person's abdominal cavity, anteriorly lined by fascia transversalis, in the pelvic cavity lined by fascia iliaca. Okay. These two fascia descend down, one from the pelvis, one from anterior abdominal wall, and they meet at the inguinal ligament region. The femoral artery which is descending now take a look at the other diagram. The femoral artery which is descending down carries both these fascia downwards into the proximal part of the femoral triangle, resulting in formation of a femoral sheath, which is therefore anteriorly formed by fascia transversalis, posteriorly formed by fascia iliaca. Perfect. So that's my femoral artery, and it has brought this about. Remember, this has happened because the artery was inside the cavity, whereas the femoral nerve here is outside the cavity and is therefore never a content of femoral sheath. Remember this very important sentence. Now let's take a look at something very sweet. Femoral sheath is not developed in newborn babies. Why not? Because the thigh region is completely flexed at the hip. As they begin to extend the hip, the sheath gets pulled down and develops. Okay? Right. So let's talk about now the anatomy of femoral sheath. Okay? You can see how it's an asymmetrical funnel. Now do this, all of you. Funnel, asymmetrical. Funnel, asymmetrical. So one wall is vertical, the other is oblique. Okay? Put that in your brain. Correct. The length of the sheath is about 3 to 4 centimeter. It is formed by, let's talk about its formation and walls. Its anterior wall is formed by fascia transversalis, we discussed that. Its posterior wall is formed by fascia iliaca. Lateral wall is vertical. Medial wall is sloping laterally. So that's why asymmetrical funnel. Okay? Right. So if it is enclosed, if the structures inside are enclosed by the sheath, surely they have to come out. So some structures are piercing the femoral sheath. What are these structures? Let's take a look. The structures piercing anterior wall are branches, superficial branches of femoral artery. Now we've recently done the femoral artery. What are the superficial branches? Superficial circumflex iliac, superficial epigastric, superficial external pudendal. There are some structures which pierce the lateral wall, which is the femoral branch of genitofemoral nerve. Medial wall is pierced by your favorite vein. Which one? Yes, it's the great saphenous vein. So the sheath may be there, but some structures are piercing it and coming out. Okay? Right. This femoral sheath is divided with the help of two antero-posterior septa. Please note the arrows there. Dividing it into lateral, intermediate and medial compartment. As you can see, the lateral compartment contains femoral artery, along with which nerve? I just told you. Femoral branch of genitofemoral nerve. Yes. The intermediate compartment contains your favorite vein. Which one? Femoral vein. And medially you have your medial compartment, which we call as the femoral canal. So at this point, I have completed my discussion on the femoral sheath itself. Except for the medial compartment, which is femoral canal, I will now be teaching you femoral canal. So let's talk about the medial compartment or the femoral canal. Come to that point there in the diagram now. This is your femoral canal. It's a conical shaped medial compartment of the femoral sheath. That's how I would like to define it. Measuring 1.25 centimeter. It has an upward base. It's wider above, the upper end of which is called as the base. The base is formed by femoral ring. Can you see these edges here? These form what is called as a femoral ring. It is through the femoral ring that the femoral canal communicates with the abdominal cavity. Got it? Each ring has got an anterior boundary, posterior boundary, medial and lateral boundary. It's a nice firm ring, okay? So who forms these boundaries? Anteriorly, it's the inguinal ligament. Medially, it's the base of lacunar ligament. Posteriorly, it is formed by pectineus, which is not drawn in the diagram. And laterally, it is formed by the medial anteroposterior septum and the femoral vein. The image is clearly showing you this. You don't have to really memorize. Just look at the image, you'll learn. So what is the applied importance? Why are we discussing? Kyun karne ka ye sab? Okay. The femoral ring is wider in the females, dear students, and therefore that ring gives a larger space for contents to pass down as seen in this diagram. Can you see that contents have passed down through the canal, result through a wider femoral ring, resulting in femoral hernia. So remember, females have more occurrence of femoral hernia than the males. Okay. Take it further, discussion of femoral canal continues. The femoral ring is not open. It's covered by a septum called the femoral septum. Take a look here. Okay. And that septum is not flat. It is depressed. So it's called as there is a fossa formed called femoral fossa. So femoral canal, femoral ring boundaries, femoral septum and femoral fossa. These are things you have now learnt recently. Okay. Remember, the boundaries of rings are very important. Correct. So, some more important relations of sheath and canal have to be last understood. If you recall, the sheath is deep, covered by fascia lata. Now remember, fascia lata had an opening in it called the saphenous opening. The saphenous opening has got an upper lateral and inferior sharp margin or falciform margin, if you remember. And on the medial side, it is ill-defined. The sharp margin is anterior to the sheath. This is the sheath, okay? The sharp margin is anterior to it and the ill-defined margin passes behind the sheath, okay? This is the situation. The whole saphenous opening is covered by a Cribriform fascia. Any structure passing in or out has to pierce the Cribriform fascia. So this gives us some idea of the canal and sheath. Let's talk about the contents of the canal. What does it contain? It contains a lymph node of Cloquet. Say it once. Lymph node of Cloquet. Okay. And it contains some loose areolar tissue and some lymphatics. That's it. Then question is, what functions does it perform? Before we get into functions, I want you to draw the diagram with me and consolidate this knowledge. Ready, students? Let's draw. Let's draw the anterior superior iliac spine. Now draw the pubic tubercle, pubic symphysis. Draw the inguinal ligament extending between the two. Carry it back to form the lacunar ligament. Now draw the femoral sheath. The lateral wall is to be drawn vertical, medial wall sloping downwards and laterally. Divide this into lateral, intermediate and medial compartments with the help of antero-posterior septa. Now let's draw contents of each compartment. Here is your femoral artery. Draw it, color it. In front of your femoral artery lies the femoral branch of genitofemoral nerve. In the intermediate compartment, add your femoral vein. Ensure that on its medial side, you keep space for drainage of the great saphenous vein, which drains into the femoral vein. Now color this as well. Now in the medialmost compartment, add your lymph node of Cloquet. Again take a green color. This time draw the saphenous opening. If you remember, saphenous opening has a lateral and inferior sharp margin. Draw the sharp margin well. On the medial side, the margin is ill-defined. Draw it that way. Now you have your saphenous opening. Cover that with tiny yellow dots. What do these dots indicate? These dots indicate presence of Cribriform fascia that covers the saphenous opening. Structures that emerge out from it pass through the Cribriform fascia. First structure, superficial epigastric artery. Second, superficial external pudendal artery. From the lateral side, also add the superficial circumflex iliac artery. Now take a brown colored chalk and cover this space up with the femoral septum. That completes the diagram of femoral sheath. Right. So now we are going to talk about the function of femoral canal. What functions does it perform? It is essentially an empty space. Okay. So this empty space is a space in which your femoral vein will expand when it expands due to increased venous return. It is also a space through which lymphatics pass upwards, communicating the deep inguinal lymph nodes with the external iliac lymph nodes. Right? So that's the function. What is the function of sheath then? The canal is acting as a conduit for lymph nodes. What is the sheath doing? The sheath is allowing for free gliding of the blood vessels beneath the inguinal ligament. You just imagine when you sit down and there is acute flexion of your thigh to your abdominal wall. The veins and artery are able to easily glide because of presence of femoral sheath. Okay, right. So let's now talk about the last topic for today, femoral hernia. We've done the sheath, we've done the canal, we've discussed the important femoral ring, and let's talk about the hernia now. But for young students, it's difficult to understand. So let's revise or let's tell ourselves what is the meaning of a hernia. A hernia is when a tissue from inside passes through an abnormal opening to emerge outside. In case of femoral hernia, the abnormal opening is the femoral ring. Okay, so this is how the abdominal contents have passed through the femoral ring, which is our weak spot, and have emerged into the femoral canal, forming a femoral hernia. So this is the ring. The narrowest portion of the hernia is called as the neck of hernia, and this here is the hernial sac itself. Okay, remember it all is because of the ring. If the ring had not allowed the passage, there would be no hernia. Okay, correct. So now we come back to the same case with which we started, where she had a left-sided inguinal swelling, increasing on standing, decreasing on lying down. So what is happening in her case? This is the femoral canal, vein, artery. This is the wide femoral ring through which the contents have started to emerge out in the form of a femoral hernia. This is how it happens. On examination, it was found that it was below and lateral to the pubic tubercle. Now note the pubic tubercle here. Can you see how it's below? The hernia is below and lateral to pubic tubercle? Okay, that's the femoral hernia. So we have understood that abdominal contents passed through femoral ring, okay, and came out into the femoral canal and outside in the form of a femoral hernia. I think you got that. Now I want you to think in which direction will they go. Okay, so begin. First, they will go downwards through the femoral ring. Then they enter which canal? Femoral canal. Then they exit from femoral canal. They pass through and they find that there is a saphenous opening in front of them. Wow, nice, I can escape. So what do they do now? They pass forward, downwards, forwards. They pass through the saphenous opening and they come out in your superficial fascia. Then they find the sharp falciform margin. They wind around it. Okay, passing downwards, forwards, upwards, backwards. This is the falciform margin. Downwards, forwards, upwards, laterally. Downwards, forwards, upwards, laterally. Will you do that with me now? Downwards, forwards, upwards, laterally. That is the direction of femoral hernia. Okay. Now you will wonder, madam, why do you give us all these details? We don't need it. Of course you need it. Okay. I'll tell you why you need it. Right. So downwards, forwards, upwards, laterally. That's the last time we do that. And then remember, the femoral hernia occurs when abdominal contents are allowed to pass through femoral ring. I want to again make you understand the importance of the fact that it is the femoral ring which allowed it. Okay. Let's come to the next thing I want you to think of. What is reducible femoral hernia? When the hernial contents are able to go down and on lying down or on putting the contents back, it's able to go back inside. It's called as a reducible hernia. In this case, she is saying that the hernia, when she lies down, it gets reduced. So who is allowing structures to go out? Femoral ring, but it's allowing the structures to come back. Such a hernia is called as a reducible hernia. So now question is, in which direction will you reduce the contents? How did they come out? Downwards, forwards, upwards, laterally. So how will they go in? Medially, downwards, backwards, upwards, exactly in the opposite direction. You will have to push exactly in the opposite direction for the hernial contents to go back inside. Okay, so medially, downwards, backwards and upwards. That's how it will go back. Next question. What is irreducible hernia? If you can reduce it, is there something when it cannot be reduced? Yes. When the femoral ring, okay, grasps the hernia in such a way that it does not allow the hernial contents to come back, then it's called as an irreducible hernia. Okay. Last question. Then what is strangulated hernia? Ma'am, we thought it was the same thing. No, it is not the same thing. So strangulated femoral hernia is when the femoral ring not only grasps it, it compresses it, preventing blood supply to the herniated sac. Now this is a medical emergency. The distal sac which is not getting blood supply is likely to undergo tissue death and gangrene. It's very important to quickly, urgently restore blood supply to the distal part of the sac. How can we do that? How do we do this? I'll tell you how we do it. Here you are seeing the canal and you're going to go and cut off the lacunar ligament. When you cut the lacunar ligament, the femoral ring expands. The medial boundary of femoral ring was lacunar ligament. You're cutting it. So the femoral ring becomes larger. The sac can now be reduced back inside. Okay. What is the problem here? Ma'am, it's so easy. Yes, there is a risk here because lacunar ligament is related to an abnormal obturator artery sometimes. I won't talk about this. It's for you to explore further. What is abnormal obturator artery? Find out. If you need me to explain it to you, I'm always available. So, coverings of femoral hernia. if it is going down through so many layers, it acquires a series of covering, students. Okay, so think of it as one organ covered by peritoneum, reaches the femoral ring covered by femoral septum. So first covering peritoneum, second covering femoral septum, descends into the femoral canal, anterior wall of femoral sheath, passes through that, reaches Cribriform fascia at the Saphenous opening, passes through that superficial fascia and then skin. Let's do this once more. Covered by peritoneum, femoral septum, anterior wall of femoral sheath, Cribriform fascia, superficial fascia and skin. These are all the coverings covering the femoral hernia. Okay, this will be asked you when you go to your senior years, if not asked in your first MBBS. They can be asked in first MBBS also. Right. So what are the factors that predispose to hernia? Now you don't have it, I don't have it. Why do they have it? There must be some factors causing the hernia. The factor is basically one, anatomy of pelvis. If the pelvis only is so wide, for example, what happens in females, the ring is wide. The ring is wide, more likely the contents will begin to pass out through it. Second is weakness of abdominal wall. Again, we come back to the females. They go through childbirth, repeated childbirth, delivery process, associated obesity, causing this area to become pretty weak, allowing for herniation. Increase intra-abdominal pressures, tumors, pregnancies, again causing hernia. And age itself. As you age, sometimes the ligaments become very lax, allowing for organs to or tissues to begin to herniate out. So these are factors predisposing to femoral hernia. Right. So now, what are the other types of hernia in the same region? How will I differentiate the two? So the other hernia I find, look at the image to understand. The other hernia is a direct or indirect inguinal hernia. What is the difference? The pubic tubercle lies, the femoral hernia lies below and lateral to the pubic tubercle. Inguinal hernia lies above and medial to the pubic tubercle. That's the difference. Have you got it? Femoral hernia below and lateral. Inguinal hernia above and medial to the pubic tubercle. Right. So see if you've understood the case. We read the case. Same questions. What is this condition called? Ma'am, it's called as femoral hernia. 2. What is femoral sheath? It's a sheath of fascia which descends downwards, conical in shape, enclosing proximal end of femoral artery and vein below the inguinal ligament. Fine. What is femoral ring? Describe the ring, give its boundaries. I'm confident you can do it. What are the causes predisposing to hernia? We just discussed them. What are the other types of hernia? I need to differentiate this one from, I told you, inguinal hernia above and medial to pubic tubercle, femoral hernia below and lateral to pubic tubercle. Got it? Right. So use these sheets. I'm not going to read it again, students. Use these two sheets to help you revise the topic. Okay, just go through them. You will automatically revise the topic. You needn't go through the entire video again. Yes, although it will give me more viewer time, but don't worry about that. I want you to just go to these two sheets and revise quickly, and there you will be ready for the topic. Solve these MCQs. I can give it to you in writing that you will be able to solve them. I'm confident you can do it. And finally, let's see if you can solve this one. Let me try. Femoral hernia passes through. So easy. Passes to superficial ring? No. Deep ring? No. Femoral ring? Yes. Umbilicus? Definitely not. Okay. So sometimes MCQs are very simple, but you do have to know something to be able to attempt them and get your answer right. Isn't it? So with this, we end a very, very sweet class. I loved it. I hope you did too. Don't watch the clock, students. Do what it does. Keep going. Okay. So let's see you across the screen in some other video. My request is go to my website and solve MCQs. They are put up there for you. I want you to go on the website and get into the habit of solving MCQs every time you watch a video. Okay. Thank you. See you in some other video. Bye.